Hello and welcome to a Therapeutic Hour. I'm your host, Michelle Overton. Whether you're here because it feels dark, you feel stuck, or you simply want to understand yourself better, you're in the right place. With over 400 types of therapy out there, it's no wonder it's hard to know where to begin. Join me and my guests as we demystify therapy and support you to self-heal. So settle in, relax, and let's begin your journey inwards together. This is a Therapeutic Hour. Today's episode has a slightly different take. I'm in conversation with my own craniosacral therapist, Priti. I share some of my own experiences of accessing this incredibly healing bodywork therapy, which has been described as having counselling without having to talk. Let's welcome Priti, a qualified craniosacral therapist, a bodyworker and a light worker. She's been working with the body for over the last 25 years and facilitates the body's natural, inherent power of self-healing, empowering people to live the life they want to. Oh, good morning, Priti.
Morning, Michelle. How are you?
I'm all right, thank you. Yes, how are you doing?
Yeah, good, thank you. Looking forward to our chat.
Yeah, brilliant. I'm so grateful to have you here. I know that I've been working with you personally as my therapist for the last 8 years now, and you have seen me through some of my darkest times. And really, you have inspired me with this podcast because I felt it was so important for other people to be able to understand what craniosacral therapy is. So I wanted to start with asking you about how did you find yourself to become a craniosacral therapist?
Oh, God, I'm going back about 14 years now, 14, 15 years. And I actually had a problem with my health. And one of my clients just said to me, and I'd been to see the doctors and trying to help myself. And it was just like nobody had the answer. So my client said to me, you know what, you need to go and see this craniosacral therapist who's in Northampton. And she said, I don't know how it works, but she said, I just know that when he sees you and he touches you, he'll pick things up that doctors don't realise.
Wow.
And at that point, I was like, oh, I'll try anything. I'll absolutely try anything. And he was an osteopath, and I went to see him. And I remember saying to him, I don't want any osteopathy. So he said, well, what can I do for you? And I said, I don't want any bone crunching. And he just sat back and he said, right, are you going to tell me what I can do for you? And I just said, I want some answers. And it just came like that. I said, I want some answers. And he said, right, okay, now I know where we're going. He said, let me treat you. And the amazing thing was that I actually didn't tell him what was wrong with me and what I needed help with. But the thing that was wrong with me, as he was treating me, it just stopped.
Wow.
And it was, I can share it. I'd been bleeding for almost 18 months.
Okay.
And, I wasn't menopausal. I hadn't got anything wrong with me. Nobody could decide why this period was lasting so long, and I was getting more and more depleted. And it just got to the stage where you think, my doctor just said, have a hysterectomy. And I just thought, wow, that's quite out there, isn't it? And I didn't want to mess with my body. I just wanted to help myself. And so when I met Christoph, I never told him any of this. But when we finished the treatment, and obviously, I went to the bathroom before I drove home, there was no blood. And there was no blood for about 2 weeks.
Okay, so I know that I think you've described it like this to me before with craniosacral therapy, that it can be like having counselling without actually talking, which fits in with what you were saying with Christoph. You didn't tell him what was going on, but he was able to work with your body. So could you tell me a bit more about this?
Well, craniosacral therapy, osteopaths use it, chiropractors use it. And they, in a sense, they do it quite mechanically, whereas I work quite spiritually with it because I'm a light worker and I work with the light of your soul. And it's basically listening with my hands and seeing with my heart. And it's a non-intrusive touch, and it's the art of doing without doing. So you're basically tuning in to the body and listening to the trauma that the body is going through, or the trauma that has been imprinted on the body, and actually tapping into the innate ability of yourself to heal, because we've all forgotten how to do this. And so it's just giving a reminder to the body to say, you know, you can heal from this. And because you've kind of like shut down and kind of like enclosed yourself, I can facilitate that for you because I can help give you that space. And it's one of those things where you have to explain to people, do you know what? I'm a healer by birth, but when I'm treating you, I'm actually doing nothing. All I'm basically doing is holding the space for you and giving you that sense of safety to move forward or to approach what you've been through. That's all it is, basically. However, we are working on the fascia, the muscles, the cerebral fluid that surrounds, you know, all your nerves in your spinal cord. Mm-hmm. And it's just an amazing thing to be able to train, to be able to touch someone with a butterfly touch, but to feel that movement underneath the surface of the skin.
Yes, and as you were talking, it was reminding me of my times when I've come to you myself. And so how I would describe it is that what I felt is, I can remember one time when you were working on my core and I could feel some of my chakras unlocking. I could actually feel them. I don't know if you want to be able to say any more about that. I'll give you a little bit more. I can remember it was a clinical psychologist who had recommended for me to come to see you in the first place. So a bit like yourself, where you have somebody that recommends the person or the therapy. And I'm the type of person that I thought, look, I want to feel something. Mm-hmm. So I can remember coming and laying in your wonderful room, which I can see in the background now. And actually, that's what I did feel. I felt my chakras unlocking as you were working with me.
And I think, you know, working on the energy centers, you know, sometimes they just get so blocked because you're scared of what's happening to you and what you're coping with. So it is about opening the energy centers up, but, you know, you don't do it as a crystal therapist or somebody that works at chakras. It really is just being in tune with your body, and then all of a sudden you yourself go, oh, that's the block there, hang on, what's happening? And then there's this magical, you know, sort of dialogue between you, me, the energy in the room, and that dialogue then says to you, it's actually safe to let a little bit of flow through that center, you know. And as soon as you start to feel safe, then you soften. It's all about softening you, softening the system, helping you to feel safe. But it's amazing work, absolutely amazing work.
Well, it really is. I've definitely felt held. So really safe, really held. I know when I first came to you, my youngest son was on the liver transplant list. And so as well as feeling those energy centers, feeling that they were becoming unblocked, I saw lots of things in my mind as well, which, as you were just describing, things that perhaps as I softened, insights came to me that made sense. And I know I've shared some of the things that I've seen before when we've had the therapy. You know, it's been an option whether I want to talk or not.
Yeah.
And but you give me a space that if I want to talk through things. And I might share. Oh, go on.
I was just going to say, you know, being a body worker, I work slightly differently from, the talking therapies. I mean, I do a embodied wellness therapy as well, which is all about getting you to recognize that felt sense and stuff. So it's not about saying that talking therapies don't work. However, when you go inwards and you can kind of feel the things that you're blocking out, your body then starts to just reset.
Yeah.
And when you're resetting, all these images and stories come up that you've been holding.
Yeah.
And we have a choice, don't we? We can either fear those stories, or we can become the observer in the stories. And that's what I teach you. Just look, just watch. You don't have to have a reaction. You can go to a still point during craniosacral treatment, because that's at that time, that's where you need to be. Or something will come up and you think, oh, just need to tell Priti this one. Yeah. And there's no right or wrong.
Yeah, I understand.
Yeah.
I'll edit this bit out because I was going to make a joke.
Sorry, I was going to say, sorry, I know I interrupted you, but it just needed to be explained in that moment.
No, it's lovely. And what I was going, because I could hear the dog, I wanted to say a joke about, I think the dog agrees as well. But then I thought, no, don't say that. So, would you say then that it was from having your own treatment that really inspired you, that you thought, actually, look, this really works. I want to become a therapist myself?
You know what? Absolutely, 100%. I mean, I've always been told I've had healing hands ever since, I was bodybuilding and doing all the holistic massages and stuff. And through my own life and traumas and the things that I went through, I always knew I was a good person. And that's why I kind of have strived to have a life full of the things that I missed as a child and as I was growing up. And as I started to achieve these things and to have that sense of belonging somewhere and not being that orphan, I quickly realised what I wanted to do for other people. And, it's that saying, isn't it? When you know your why, you'll know your what, or vice versa. Mm. And I quickly realised that feeling I felt when I had helped someone was, it's the best feeling in the world. And it was actually feeding my soul. Yeah. And for the first time in my life, I had realised what I'd already known all my life, that it was always about self-soothing, about nurturing yourself, about being kind and compassionate to yourself. And I just thought, if I've already tapped into that and I can train as a craniosacral therapist, and that's what I teach people. You are entitled to live the life that you want, to have the ups and downs of, what life throws at us. But we all have this ability to be able to heal, to move forward, to be our own counsellors, and some of us, don't have that ability. And so that's why they reach out and speak to the people like you, myself, and other treatments. But you know what? I kind of feel like it's my job to go, right, okay, this is the gift. This is for you. Now you can get on with it.
Yes. And this is taking me back to what you said, actually, about with talking therapy and having bodywork therapy as well, because so I know for myself that I've had to have a real mixture, because we're all taught how to think, but not how to feel. Yeah. And you quite rightly said about the trauma that is held within the body, and that's what you're facilitating, aren't you, for people to be able to. In fact, actually, can you tell me, how does that work when you work with the trauma with the body?
So everything that we go through life, joy, fear, all the problems in life, they're all held by the body.
Yeah.
And everything in our life leaves an imprint on the body. And so the body carries on holding this stuff, and because we don't deal with it and we disassociate with it, once it gets overwhelming, that's when you crash. So you disassociate by not having that sense of feeling, and every emotion is a feeling in your body.
Yes.
So how I deal with it is that I try and get you to be aware of what's going on inside you, but also to be aware of what's going on just on your boundary. Yeah. So if you, and then bring you back to you, and then say, so what are you noticing inside? What, where is that feeling being sent? And a lot of people, when they're talking, one of the greatest examples is when they go, oh my God, it was awful. And then you say to them, you've actually just held your chest and your heart. So when you talk about that awful situation, if you think about it, where actually are you feeling it in your body? And 100% of the people go, oh, actually, it's lower down.
Yeah.
So it's then about teaching them where they're holding the traumas and the life experiences that they've been through, and then trying to get them to go to say, how does it feel? What is it that you feel you need to alter? And to try and say to them that every time you think about this event, you're re-traumatizing yourself because you haven't actually got any answers.
Yeah.
So then it goes a lot deeper, and then we work on creating safety and to get them thinking about things in a different way. Do we need to alter the things that have happened to us because we actually haven't got the power?
Yeah.
So how do we get you to be in the present, to be the observer in the story of your life, to look at stuff and not react? Well, the way you do that is by teaching them to be compassionate to themselves. And so that is where the compassionate inquiry comes.
Yes. And as you're talking, I'm thinking about, and I feel happy to share that. So after I'd lost my oldest son in December 2022, 3 days later, my cottage had totally flooded from the top floor. It had rained down. Mm-hmm. So I hadn't been able to come home. It was an absolute mess. But then what also was compounded was that hollow feeling in my stomach of trauma, of I'm not going to be okay on my own. I've gone from looking after Luke, and now I've got to go back home to be on my own. And it was coming to see you that you provided that safety. Within a couple of days, I actually was able to move back in. But before that, I couldn't. The thought was horrendous of being on my own.
The biggest thing about grief is people go, and you use the word hollow, and they, our loved ones leave a vacuum, and it's how to fill that vacuum, and people say, how do I get over it? And the thing about grief for me is, who says you've got to get over it?
Yeah, we don't, do we?
We don't have, because there's all kinds of feelings that come in, because you start having that survivor's guilt. You start then thinking, why am I happy? Why am I laughing when the person that I've loved is gone? That person isn't seeing what I'm seeing and experiencing. And you then have to kind of like take the human emotion of what you're feeling out of it and kind of go back into the spiritual thing. Which we're all capable of doing, but we've just lost the ability. And I think that was the thing with you. It was about allowing you to feel all of that, but to know that you needed to still live and survive, and that it was okay, because your cottage at one point was your safety zone.
Yes.
And it was to get you to get back in there. And, and the easiest way to explain about when you lose somebody that you love, and especially a mother that loses a child. It doesn't matter whether, they're 2, 20, 40 or whatever. You're always a mother, and you always have that big connection. And the thing about that was to say, it doesn't matter how old Luke was, there'll always be that love, and your grief is just a load of love with nowhere to go.
Yeah.
What do you do with it? Yeah. And you put that love back into you.
Yeah. And it for me, it was feeling safe. I think feeling held and feeling in my body that I was safe and that I could cope.
Yeah.
But I wanted to say, so I've come to you with loss, with grief. I mean, lots of things, I think, with trauma. Who would you say could come to you to access your therapy? What would it be good for?
Everybody and anybody.
Yeah.
Humans, cats, dogs, horses. I know Christoph is a veterinary osteopath as well, and he treats horses. I mean, craniosacral therapy is about touch, isn't it? Touch is transforming. So I can work with babies in the womb. I can work on mother and birth trauma, and then anything that's in between, and then right over to the other side to your last breath. So helping you to let go. Yeah, I had the real privilege of giving my mum healing the day before she passed. And the nurses said it was the most calm that they'd seen her. So to have that ability, I suppose, to kind of let the body know that it's okay to let go when the time is right is absolutely amazing. So you can treat anxiety, depression, and because we work with the fascia, the muscles, the tissues, you can treat injuries, you can treat pain, you can treat rehab, headaches, sickness, IBS, you name it. The craniosacral system will help you to heal, because we're working with the tides of your body, we're working with the fluids. You'll come in for a cranio treatment. If you're down, it will give you potency and vitality. If you're high wired, it will slow you down and help you to rest and reboot. So it's like unplugging you and recharging you. Whatever your body needs, once you're with your therapist, it will take.
Yeah, I actually didn't realise that you could work with babies in the womb and then right up to end of life, because it is that touch as well, isn't it?
Yes.
I know, I'll give you an example. I know that I've gone to sound healing, meditating, but it's when I felt that touch that it's helped me to have a deeper sense of release. And I think if you're a single person and not having that connection, to then come and to feel held in that professional way has also been another part of that can really help to deal with loneliness for me.
Yeah, absolutely, definitely. And it's that sense of belonging.
Yes.
Somewhere, to someone, or that belonging to yourself. And knowing that it's okay, that your love and your nurturing for you is your strength. But the other thing I was going to say to you is that it is about touch, and it is about touching the body with a light butterfly touch. But very occasionally you get someone that their nerves are so fired that they don't want you to touch them. That comes from a place of fear, because they think your touch is going to cause more pain. So you literally can sit in the room and work off the body.
Right.
But they're kind of different cases of what they need.
Yes, so gauging that. And that actually leads me to ask you about, I mean, I've never had an online session with you. I've always, been able to come to your place. But how would it work then when people are having treatments online?
So it's basically working through the energy, the quantum energy of the universe. You can do a FaceTime, get them to lie somewhere really nice, comfortable. They can leave the phone or the laptop on, or they can just turn everything off. And I will sit in my room and focus them on my bed, and I will tune in and just work that way. It's
Right.
it's an amazing thing to do. And on the Craniosacral website for my college, they do talk about distance healing and how it works. Is it People say, is it Reiki? And it isn't Reiki, because Reiki is about taking the energy from the universe and putting it into your body.
Okay.
Whereas craniosacral therapy is about the energy that you've already got or haven't got in your body.
Okay.
And just
So it's about the energy that you have or haven't got. Tell me a bit more.
Well, so if you're depleted, you haven't got that vitality and potency, and you've got blockages everywhere, and your mind is cluttered,
Okay, yeah.
So when you do the craniosacral therapy in that sense, what you do is you create space in the brain.
Wow, okay.
And so you create space, and then you create more flow. So in what we call the midline, which is basically, starts at the base of your brain and goes right down to your sacral. And it's basically your spinal cord. And
Okay.
so it sits in cerebral fluid, the cranial nerves, and all the nerves come out of your spine and then nurtured by the cranial fluid. So what we do is, if you haven't got that energy and you're depleted, we'll work on the fluids, and we'll work on the ventricles of the brain, and to create more fluid for you, so you get more potency. However, if you're wired and your brain is doing this all the time, we then help to quieten the brain, and we'll work on the heart, we'll work on the adrenal glands, because sometimes depletion, you get that because you're full of adrenaline and cortisol.
Yeah, my goodness. Do you know, as you're saying this, that was exactly me when I was coming to see you last year, because I went to put my lipstick on and my teeth were chattering in the mirror because I felt totally wired. And I can remember coming to you and the brain feeling as though it had been quietened down, and I could feel even my shoulders and everything, relaxing.
Yeah. Do you know what? The subject of craniosacral therapy, you can do it in about 100 words, or you need 100 books.
Yeah.
It's so vast, but the beauty is that it was invented, by an American osteopath over 100 years ago, and he realized that when you touch someone, you can actually feel the rhythms, the different rhythms, that every cell has a rhythm, every bone has a rhythm. And we're kind of led to believe that the body is just still, but actually on a day-to-day basis, your body is doing this all the time. Your feet, your legs turn outwards, and your brain is swimming around in the cerebral fluids, and it's moving around. And that's what we tap into. Every bone still has a movement of its own, and that's why we can tune into that and settle things if that's what needs doing. We're not a rigid being. We flow all the time. And it's just tapping into the potency and beauty of that, just to see what's happening and what an outsider can, do for you.
Yeah. Hey, thank you. And that leads me to ask you as well about, so what results have you seen when you've been working with people? Is there any things that, you felt like you'd like to share there?
Well, I'll start from maybe a couple of weeks ago. I did a craniosacral treatment, and when the girl, I say girl, I guess she's about 35, or I don't know, a similar age to that. She'd had a really hard time in her life from when she was young. Lots of things, abuse, looking after people in the family, fallouts and stuff. And when I finished, and the beauty about craniosacral therapy is I say to people, I'm not psychic. I'm going to do the treatment. Whatever comes up, I'll pick it up, but I'll work with it, but I don't retain the information. However, if afterwards you say something to me and it triggers it, I'll be able to tell you and talk about it. But don't ask me, oh, what did you find? What was this? What was that? So it's really a neutral playing ground. And when we finished and she sat up and she'd got a little tear down her face, and, you know, you have to be mindful and say, you know, are you okay? What are you feeling? And she got off the bed and she just said to me, for the first time in my life, I don't feel like I want to kill myself.
Wow.
Every day, she said, I wake up and I don't want to be here.
Goodness, yeah. Real pain.
Real pain. And she just said, every morning I get up and I question the past, and the past flies through my head. And she said, but I've got off this bed, and she said, I know I'm worthy and I don't need to die.
Yeah.
And
I mean, that's
and you do
amazing results, isn't it?
Honestly. And then eating disorders, like anorexia, bulimia, and it's all about what's led that person to be like that.
Yeah.
So we pull the threads very gently, and again, it's about safety. And then you kind of work backwards, retrack, and then analyze what started that off, and then help people to reframe. That's a big thing, because people get a story in their heads, and you know that old part of the brain keeps you going over it like a cracked record.
Yeah.
And so when we can help, you know, these patients, clients of ours, to reframe the theory that they've got, all of a sudden there's a healing process that takes precedence, because they then realize, actually, I was told this by other people, by society, by parents, by siblings, by friends. But actually, if I go inwards and I look at it, I realize that's not the truth.
No, that it's been a limiting belief.
Exactly. And they're dysfunctional beliefs.
Yes.
So again, it comes back to that sense of safety and security, to be able to say, actually, I'm at a point now where I think that isn't my belief. And I actually don't need to work with that, and find the courage, you know. So eating disorders, depression, people wanting to have a life, and also once they start disassociating, they start reacting to things differently. So I talk a lot about the pause in my treatments, and I always say, you've got to do the pause before you react. And they go, oh yeah, but I count 1 to 10. And I go, no, it's not 1 to 10. If you count 1 to 10, you're disassociating. But if you do the pause, you're actually scanning yourself to see what reaction is coming up, and is your nervous system going to go into fight or flight. So by the time you've done that, you've done your pause, and you're able to look at that situation in a new profile, and then you don't react how the other people expect you to react.
Well, so this is what I say all the time, because the power is in the body.
Yeah.
And I'm telling you things you know, but for the benefit of our listeners, that what I notice is that sometimes we feel that we will just naturally respond, get activated and respond to things. There's no control, but the power is in the body, because the more in touch you are with that, so the sensations, the feelings that you've been talking about, it gives you the opportunity to recognize what's going on and practice the pause that you're saying. And I think Viktor Frankl, who was the Holocaust survivor, and he wrote the book, Man's Search for Meaning. And I probably get the statement wrong that he said a little bit, but what he was saying is that in between stimulus and response is the
Yeah,
pause, and that's
yeah.
where our power is.
And that's where the healing is. And you know, when I'm doing some of the treatments and I get people to breathe, I always say to them that gap between the two breaths is where your nervous system goes, oh yeah, I can either heal, or I can go, do you know what? You need to escape and we need to fight, and I'll let the adrenaline go.
Mm.
So once you've mastered that, the breath of life, I suppose,
Wow.
once you've mastered that,
Oh, I love that. The breath of life.
you just flow differently.
Yeah, and this is what I'm getting from our conversation. It's a lot about in this therapy. It's about being able to flow, isn't it?
Mm.
That feels really fitting with, like you say, the cranial fluid that's going all through the body.
And
I don't
I
know if I'm
always say
going
to
off a bit.
people, yeah, I always say to people, be like water. You know, if you drop water on the floor, it seems to find, doesn't it? It seems to find its own route, seems to find nooks and crannies that it goes into, you know, and then we mop it up. But do you know what? Water doesn't panic, does it? About where it's going to go. Is it going to? And if I then change that to us and I say to people, just be like water, go where you're led, but don't be scared, because you have the ability to come back out, don't you? Water ebbs and flows.
Oh, I love that. Yeah.
All the tides in our bodies, you know, the three other pulses that a craniosacral therapist is taught to recognize, they're ebbs and flows, you know?
And that feels safe just as you're saying it.
Yeah. Yeah. It's about being in touch with you. And you don't have to be scientifically minded, you know, you don't have to come in for a treatment. That's the beauty of the work that I do. You don't have to be all knowing and in the scientific field. Okay. You know, you can just come in as you. You don't need to analyze it. You don't need to question it. Do you want to heal? Do you want me to switch on your innate ability to heal that you forgot? Then come and have a treatment. Because I'm just the gatekeeper. I'll get you there. You're going to do the work, but you'll do it.
Well, this brings me to, because so I know I'm not just saying this, I can feel your healing. I think you're one of the most powerful healers that I have met in life. And I wonder, when other people are looking for a therapist, what would you say? Where would they go to find one? How many sessions do you think they might be looking at having? I mean, I'm sure that's worked out with the therapist, but can you give us any tips on that?
So there's the Craniosacral Therapy Society that have got craniosacral therapists on their lists of qualified people. So I would ask for recommendations. I would go on their websites. I would read the testimonials. I would read their personal blog about what's got them doing what they do.
Yeah, lovely.
And if it
do the research.
Yeah, if it resonates with you, then that's the person that you probably want to work with. Every craniosacral therapist works differently, and some that aren't osteopath, they still do it mechanically and they will just work with the body and fascia. But I like to work with the soul, because I know that work for me is more powerful. And so do your research, look at the person, see what you feel when you see a photo or when you read their, you know, biography of what's got them there.
Hey, lovely. I just want to say, because I thought it was really profound what you said about how you work with the soul. So can you tell me just a little bit more for the benefit of our listeners? What do you mean by that?
Well, our body carries our soul. So, you know, my Buddhist beliefs and my core psychotherapy is all based on Buddhist beliefs of compassion and kindness to yourself and compassionate inquiry to others. So a lot of things that we react to are because we haven't got that compassion and understanding for the world. So it's the soul that makes us.
Mm.
And so if through trauma, certain facets of your soul have been pulled away from the core, I try and help get some of those facets back. And sometimes, you know, you can talk about auras, you can talk about the light of the soul being dimmed because of the pressure of the life that we're in here today.
Yeah.
And so what I try and do is just turn that little bright light up a little bit more. People that are struggling, you know, whether they realize it or not, the light's been dimmed.
Yeah.
There's a certain amount of darkness around them, and darkness, heaviness. And so when your soul feels that, your body then feels that there's no way out, then the mental problems start. So if we work with the soul and remind it that it has the ability to be this most sentient being that we were born as, you change. And if, again, it's about safety, you then remind the soul that even in the darkest rooms, if you sit there long enough, you will actually start to see a bit of light.
Oh, isn't that true?
Yeah.
Oh, yes.
Yeah.
Yeah.
So, you know, with the craniosacral, you can work spiritually. I mean, I'm a master angelic Reiki. So when somebody comes in to see me, yes, I'll start with a cranial. But, you know, if your body says, actually, this is what I need, then your body can have it. I tailor make the treatment. It isn't always you're going to come in, it's going to be cranial, lie on the bed, and that's it, off you go. Because even when you've done the cranial, when the person's got up, the body's been heard. But you know, up here, the mind still needs a little bit of coaching and love. And so you have to give that space to hear the mind as well, to hear the dialogue from the body and hear the dialogue from the mind.
Hey, well, thank you, because I know that I might invite you to come back onto another podcast, because I know you also do trauma release therapy, don't you? TRE? And
TRE.
I'd like to talk to you about that another time. But keeping with cranial, so...
Well, you were asking me how many sessions a person needs.
Yes.
So everybody's healing is different. Everybody's trauma and what their body is carrying is different. Now, you mentioned the TRE. One session of TRE is transformative. Okay, it's a different way of working, but you know what? It is so powerful. The craniosacral therapy is a gentle way of healing, and it's about planting seeds in a garden.
Okay.
Watering them, nurturing them. You see something, you keep going back to feed it. And that's what craniosacral therapy is about. If you imagine how many years you've lived in fear, in a constant grip of tightness in your body, and then we slowly start releasing. Okay. Some people are amazing. They come in, they want to do the work, they want to do it now, and they'll put their heart and soul into it. They'll have a couple of sessions, and then every 2 months or so, they'll top up, because they've learned how to change the dialogue with their body. Other people will come in and 2 sessions won't be enough, and they'll need a session when they think they need a session. So they might come in every 4 weeks. But I never give you a plan. I never say to you, I want you to have 10 sessions, because I know your body will heal at your rate. It's not for me to say, I want you in every other week. I want this, I want that. It's not about me, it's about you. And I always say to people, give your body and your mind the space to integrate the work that you've done, the work that I've done, let it settle, then see what comes up, and then see what else we want to work with.
Yeah, lovely. So it's really tailor-made, isn't it? It's not something that
Yeah,
people come in every week for. It's
yeah,
as and when they need it and when their body and mind has processed it and they,
yeah.
want to tap into it again.
Because I don't give you a solution because I know you've got the solutions there. The
Mm.
answers are all inside you. And as you know yourself, and that's how you work, because you kind of pull the threads and you kind of go, don't stop thinking there. Come on, just move a little bit to the right or a little bit to the left and see what else is coming up for you.
Mm.
And that's great, because that then is inquiry, isn't it? The way the world and people are healing is changing so much. And
Yeah.
as therapists, we've got to go with that flow.
Yeah, and it is about wanting people to get better and to find
Yeah,
the right therapy that suits them because
yeah.
so I know, we might need a mixture of talking therapy, but a
Mm.
mixture with the body work. My supervisor was saying to me, there's over 400 plus therapies, and that's why it's important that people start to understand why these type of therapies work.
Yeah, but it's
And,
also important for us to work, us therapists, to work as a collective to heal.
yes, I love what you're saying about working together. It's for the client to find the therapy that is going to help them to facilitate that healing that they
Yeah,
need.
yeah.
And I know we're going to come to an end. I could talk to you forever. But what I wanted to ask before we go is, so what would be the words of wisdom? If you were to sum up cranial sacral therapy, I know you said you could sum it up in 100 words or 100 books. How would you end today's conversation on cranial sacral therapy?
Well, I'll read this to you. So, craniosacral therapy is educated, specific, non invasive touch that supports your body's innate ability to heal.
Oh,
So, it's named after the craniosacral system, which is the bones, tissues, and fluid that support your central nervous system. And it's got a rhythm all of its own. You've all got the ability to heal yourself. You've just forgotten how to do it. And all I do with my gentle touch is facilitate that feeling. So, to remind you that the answers are all inside you, to relax, not to hold yourself so tight, and just let things process through your body.
yeah,
Let them process and then just release and let them go.
yeah. Oh, I love that. As you were talking, I felt really warm. I want to say thank you so much for your time. I've really, really enjoyed talking to you, and I feel like I've learned so much more myself. So I hope our listeners have learned more about Cranio as well. I'm sure they have. It was brilliant, Priti. Thank you very much.
Thank you, and thank you for the opportunity. And just like you, I could sit here all day and just have the conversations, about the work that I do, the work that you do.